rearrange the schedule a little bit to move our school winter sports program discussion up a little bit. But first, in sort of the normal order, we'll take up the review and approval of meeting minutes. I believe we have the November 5th minutes ready to go. I was not present for that meeting. Does anyone have any comments on that set of minutes?
Nope.
No.
No, I don't. Nope.
So I'll motion to approve the minutes of November 5th, 2020.
Second.
Okay, it's been moved and seconded. All those in favor?
Aye.
Aye.
And I abstain. Glenn, you notified me that the December 3rd minutes are not prepared yet, so we will move on from those.
Yep.
Review and approval of expense warrants. Do we have any warrants that needs somebody come in to sign?
Yes, we have 2 sets.
2 sets? Okay.
Ernie's been in to sign them, but we need either you, Brian, or Ronnie to come in.
Oh, I'm sorry. I came by too. I could have signed them. I wasn't thinking.
It's okay. We're here every day.
Okay.
Every day?
Almost.
All right.
Can I just have a quick, did we approve the minutes? I don't think we approved the minutes of October 29th, did we?
Yes.
We did?
Yep.
Yeah. Because I had some comments for that, but I guess I'll hold off. I guess I can't do anything about that, but there were some of them were just typos, so it was all right.
Yeah, did we approve those? Now that I'm thinking about it, I feel like we had a set that was open.
I don't think we did, because I
Yeah.
reviewed them. Anyways, I'm gonna go. Let me get them.
All right. I'll
I don't think
double
we did
check,
either.
but I thought we took care of October already.
Yeah, I kind of feel like Ronnie's right. I think that I think you had some, maybe you hadn't been able to review them yet, so we tabled them.
Right. That's exactly right.
Yep.
And so I have some corrections. I do one or two I want to make note of for October 29th. But
Okay.
All right. Well,
Yeah,
we'll put
well,
it
no,
back on the
there's-
agenda if we haven't gotten to it.
Yeah.
I thought we had.
Brian, you weren't there. It just
November
said board
20th.
members present, myself and Ernie. Yeah, you weren't there.
Okay.
So
Yeah,
I
why don't we
just-
try to get those on the, let's get those on the next agenda because they're not listed on here. So yeah, we'll do them when we can get them on the agenda for the next meeting.
Okay.
So then let's move on to the discussion of the school winter sports program. Glenn, if you could kind of kick off the discussion for us here so we're all on the same page as far as what we're looking at.
Sure. I had prepared comments which I forwarded to the board. On Friday, 11 December, a request came down from the town manager's office regarding winter sports at the high school. And the question was really if there should be a high-risk sport season this winter rather than under what conditions the guidance allowed the sports to be played. So I told the town manager I would research it and get back to him as the board had not discussed it. Shortly after that, Stacy Skakel, the school nurse coordinator, called and we spoke with her briefly about it and set up a conference call with the superintendent on Monday, 14 December. My research included an internet search of the Hull school decision to cancel winter sports and comments from other schools in Westford and other towns. And I have sent the petition that was brought forth in Hull to reverse the decision to cancel winter sports and one newspaper article about Westford and other towns. On Monday, we had a conversation, we as in Kate, the assistant health agent, and I had a conversation with Patty DeBoer, the school superintendent, Hope Hanscom, the school assistant superintendent, and Stacy Skakel, the nurse coordinator, about the winter sports program and the COVID-19 situation which may affect the sports program. Nurse Skakel presented a real concern about the rising community spread, positive COVID-19 cases that are affecting the school kids. Right now, a significant number of kids are home quarantining or isolating due to exposures, but there has been no confirmed in-school spread between students. The students have been exposed by parents, siblings, or friends out in public. Superintendent DeBoer stated that she'd rather have the Department of Public Health or the state school board make a statewide decision for sports. The reason for that is once the school cancels their winter sports program, the kids will go to private hockey and basketball leagues where there could be less COVID-19 controls in place. We discussed the different levels of participation that are in the guidance. The other schools that have canceled their winter sports programs have done so across the board. There was no mention of allowing participation in practices, which is level 1, individual or socially distant group activities or inter-squad scrimmages. Level 2 is competitive practices, and level 3 being interscholastic games, and level 4 being participation in tournaments. On Wednesday night, last night, the health agent and I listened in on the school committee's meeting where the sports program was discussed. Matt Treveri, athletic director, made a presentation that outlined some of the safety guidance that has been made for the winter sports program. I made up pros and cons, some listing for canceling winter schools. The goal is to keep, well, the pros, if to cancel winter school would be, the goal is to keep kids healthy and in school. The rise in COVID-19 cases in the community and the documented occurrences with positives from other high-risk sports teams are affecting that goal. The healthcare system and the contact tracing professionals are overwhelmed now. The school cases that may involve an entire team could easily make the situation worse where it affects the follow-up for other cases. Contact tracing process is slow anyways because of the time it takes for the labs or the initial orders of the positive to enter the case into the database and then have the contact tracers actually reach the positive to determine the close contacts. Then the contact tracers must contact the close contacts to make sure they are interviewed, get tested, and educated to quarantine correctly. The timing of the winter sports season has come after the holidays where gatherings have occurred and spread COVID-19 at an increased rate. Christmas and New Year's are coming and the positivity rate is expected to increase. The positivity rate of COVID-19 has risen to 3.53% in the last 14 days. The positivity rate is determined by the number of positive results divided by the number of total tests. 1,500 tests were administered in the last 14 days with 53 positive results. In comparison, the positivity rate on November 16th, a month ago, was 1.31% with 882 tests over the previous 14 days. The incidence rate 1 month ago was 4.6. The incident rate is expressed per 100,000 people as a population averaged over 7 days. The incident rate on December 16th, 2020 was 23.91. Well, this shows that there is community spread occurring. It's 5 times what it was a month ago. And one comment from the VNA is that they're concerned about the gatherings that occur before and after the game. For school not to cancel their winter school program, right now, there is no in-school spread right now. The kids, the parents, teachers, and coaches have been doing a great job with their safety protocols. Canceling the municipal school winters program will force the students to local private sports programs where the coaches may not have received training on all the safety protocols. We used the same example for Halloween. We knew that if we canceled the door-to-door tradition, we would force families into indoor private parties. Nurse Skakel has taken the time to perform training for the coaches to educate them on the safety measures within the DPH guidance. Included in that training is the preparation of rosters and personal contact information for close contact tracing, should it be necessary. Private sports organizations are not that prepared. There's no spectators allowed at the games. All the games will be streamed so the parents can watch online. The players arrive by bus, all ready to play. The locker rooms are not utilized. Any common areas that are used by the different teams are disinfected between the uses by DPW. At the school committee meeting, Dr. Greg Parkinson stated that the infection rate of students learning virtually is higher than in-school learning. And there are also lessons learned from the fall sports season. One positive on the team, and the entire team is quarantined, so the players know that they need to be careful if they want to continue to play. The real question is, what metric do we use to make a decision to cancel the winter sports program? We wrestled with this same type of decision when school was to open, and what would we use to make the decision to close the school? I think the answer to that is through experiences, that there would need to be a significant in-school spread or a high infectious rate, or has there been a reduction in staff or student body population where it's just not worth keeping the schools open. Thankfully, we have not had either of those situations occur. One thing that I know is that the collaboration and communication with the school has been exemplary. Any decision will be a collaborative effort, and I'm sure the student safety were in jeopardy. The school department would be well on board with any closure or discontinuance of the school. So those are my comments that I had sent to the board.
Is anyone present?
Hey, Brian, I think you're talking, but you're muted.
Thank you. I forgot I did that. I would like to open the floor to Secretary DeBoer and her staff momentarily. I just want to check with my fellow board members to see if they have any questions directly related to Glenn's comments here, or any points of clarification.
Well, one of my comments is that they use the term, the kids are bussed. Well, if I'm to guess, they're not wearing masks while they're bussed.
No, that's incorrect.
That was just a guess.
They're wearing masks.
Well, that's good.
Just like when we transport students to school on our buses currently, they're all masked. And they also have to sit in a certain pattern to ensure as much social distancing as we can. One student to a seat, it's a diagonal arrangement. And so it's about a third capacity in the buses. I think it's 23 kids.
Thank you for that. And just for the record, we all know who you are. If you could just state your name for the record for our note taker.
Sure, I'm Patty DeBoer, Superintendent of Mashpee Public Schools.
Thank you. Okay, Ernie, do you have any questions for Glenn's comments before we sort of open the floor to the school staff? No, okay.
I had one more comment.
Oh, sure, go ahead, Ronnie.
Just lost my train of thought. I'll think of it in a minute. Go ahead, Ernie. Do you have any comments?
Okay, and just one point of clarification, the COVID positivity rate, I believe, Caitlin, you said at the beginning, before we got started, that rate had risen with the last update from the state?
Yes, that's correct. It's now 4.16% positivity, and the daily incidence rate is now 29 per 100,000.
29 per 100,000.
Do they ever present that data segregating symptomatic and asymptomatic?
Not to my knowledge, no.
That's curiosity I have.
Yeah, they separate it by probable versus positive, but not by symptoms.
Okay. And I was just curious, I know that sort of in the community, it's a little different right now, but I don't recall the Board of Health having a conversation about our fall sports program. Did you?
No, we did not.
Okay, thank you.
No, and that was I guess one of my questions kind of coming into this is, that we hadn't had that discussion for the fall program. So I just wanted to clarify, I guess, a little bit of the sort of reasoning why this has come to the board at this point and that the fall program didn't come to us.
Same question.
So
Well-
my understanding, and you could correct me, is I had a conversation with a member of my school committee. The South Shore League of Superintendents meet regularly and particularly around sports. And we're going to be meeting again before the first game on the 8th of January. But we met earlier, and at that time, and I think Matt I think there's 10 schools in our league. Is that correct, Matt?
Yes, Matt Cherry, Mashpee High School Athletic Director. 10 schools in our league. Right now, 9 schools are all playing sports. All the example Mr. Harrington brought up is in our league. They have not canceled winter sports. At their school committee meeting on Monday, they were overwhelmed, I think, by parents and by students, and they have tabled that decision until December 28th. They're going to relook at that decision on winter athletics.
So I think the way we landed at this board meeting tonight is one of my committee members having a conversation about winter sports. This person is not, or at that point was not so much against winter sports as why aren't we offering everything to the other kids, which includes chorus and band, and those are specifically at this point prohibited where winter sports are not. I believe that member from my committee had a conversation with a selectman who then went to the town manager, who then went to you. So that if anything were going to prevent us from doing it, it would be through the Board of Health. That's how I think we landed here. But all of the
Okay.
Cape towns, we also meet with the Cape superintendents. We just met yesterday. And I know Upper Cape Tech is not doing sports, but they have issues with their co-op program. But the other schools that are involved with our Cape and Island Supers group, they are all doing their winter sports. And I just have to give, Matt can talk about it and Stacy as well, but, one other piece about the South Shore League superintendents, we have all, have the same agreement in terms of pulling the plug on winter sports at any given moment if protocols are not being followed or there are any concerns that we have. And that's the unified group of superintendents making that decision. So it is a day-by-day thing, but I think our kids who are super appreciative that we're moving forward and they are really taking it seriously because they do understand, I think Glenn said that if you have a positive case, show up on a basketball team, they're not going to have too much of a season because it's already much, 2 weeks shorter than it would have been. And it still ends at the same time. But I know that Matt, he can address all it is a very, very detailed list of expectations and like every little thing. If you've looked at any of the basketball guidelines, just basketball guidelines, it's a very lengthy document of sort of a checklist of what must be done. And the other thing that the South Shore League Supers also agreed is that if our team is an away team and we go to a certain location, a school, if that school is not meeting the standards, our team gets back on the bus and returns, and the home team will forfeit the game. So the game will not play. Our coaches know that we are not going to put our kids in a situation where the safety protocols are not in place. So Matt, I don't know if you want, or if you have any questions or you want Matt to just sort of give an overview.
Sure. Can I just ask one quick question in relation to was the tail end of winter sports and spring sports last year, were they both canceled?
Yeah, so the last part of winter sports would have been the state finals. That was about the only thing that was canceled in hockey and basketball. And then the entire spring was also canceled.
Okay. Thank you. So there are 10 schools in the league, all 10, I mean, presumably, with the exception of us at this moment with this discussion, the other schools are continuing on. Have any of the other boards of health reviewed the winter sports in those other towns, or has it just been through school committees and so forth?
I'm not well, and Matt might know, but based on our meeting with superintendents, it was only Hull who had Board of Health involved with their decision.
I know that
Okay.
2 or 3 of the other schools did have Board of Health input. Norwell was certainly one of them as well. They sort of just went along with the EEA, DESI, and MIA guidelines. And then there were, and with Norwell, it was also the fan piece. They started in the fall with no fans and then gradually let fans in. So it was more, it was a contact piece, I think, on their end. But there wasn't any shutdown in the fall. Hull originally shut down and somewhat was tabled that next week.
Okay. Okay. Glenn and Kate, has the state given any indication, DPH, anything from them, or they kind of just punted this to us to decide on?
The only thing that I knew was that the governor was leaving it up to the local, so I have not heard anything through DPH. I don't know if Kate has heard anything.
No, I mean, as of right now, the MIA guidance still just says to coordinate with the local Board of Health. So no, no other news.
Any guidance or anything like that from them specifically, or like recommendation? I mean, specifically from DPH, nothing?
As far as
or again,
like when
no.
cancel, no.
No, they've given us no threshold to go by.
All right. Okay.
Brian,
Yes.
Brian, can you hear me, Brian?
Yep.
Yeah.
I'd like to hear what the school nurse has to say.
Absolutely.
Hi,
Okay.
Stockel, District Nurse Leader for Mashpee. I did send a reply to Caitlin's inquiry earlier today. It was late. We have been working really closely with Matt, the athletic trainer, Tim, Matt, with all the ADs in our group. As was shared earlier, the coaches have all met with me in addition to the trainings they do with Matt. There's a ton of guidance that's come out. It's really clear. Mrs. DeBoer has been very clear on what the expectations are. The coaches know, the kids know. As Dr. Parkinson said last night, sports and athletics are an important piece, but we do need to do them safely. We do have a very detailed plan in place to address the DNA contact tracing concerns. We actually had a little dry run recently that I think our plan works. We have rosters, we have communication. I'm available. It is a 7-day a week, so I have all the schedules, the practices, the coach contact information. They all have mine. Matt shared my information with all the ADs. If we forgot anything, I'm not really sure what it is. So I think it's at this time, to go ahead and give it a try and watch it, and everybody knows what we're watching, and communication and honesty. I think I'm as good with it as I can be in the middle of a pandemic, with just being safe and just communicating. So I feel like our plan that we have in place is as solid as we can get it.
And just to add,
What grades?
I think I sent Kate and Glenn both the procedures that we use at our facility in terms of practices and games. We also have other facilities with gymnastics, which is at Flip-Flops, which is in Mashpee. They have their own set of procedures and guidelines. We're using Tony Kent as a co-op with our co-op hockey team. They also have a set of guidelines as well. So there are guidelines in place that we go and everything we do in terms of practices and games. And our coaches are well aware in our preseason meeting with myself and that they have to be met. every single day and strictly adhere to, because, you know, they're aware that if we have a positive, it's going to be a 14-day shutdown for that team. And that season is going to be pretty much gone.
Mhm. Ronnie, did you have a question? I heard you chime in there.
Oh, I did. I just wanted to know what grades that everyone's referring to.
That's a good question.
So the athletic program runs for the middle school and the high school. So it's grades 7 to 12.
So, okay.
Boy, this is the worst time of year they could do this.
Yeah, I know.
Oh.
What about Glenn? What are the other districts on the Cape doing? Are we?
I've not heard from any other of the towns, so I think if they had canceled their programs, we would have heard about it, and I have not heard anything.
Okay.
Just to chime in there, on the Cape, every public school is playing. The only 2 schools that are not playing winter sports are Cape Cod Tech and Upper Cape Vocational, for obviously other reasons, in terms of travel and transportation, different with multiple towns.
Okay. I mean, I guess for me, there's always going to be that desire to remain in a very conservative position with these types of things. So when I saw this on the agenda tonight, of course, my gut reaction is always, well, what are we doing here? The tendency to need to, sort of hunker down through the remainder of this pandemic as the vaccination program really rolls out and, starts to really hit its stride. And also considering that, residents under age 18 won't be receiving vaccination at this point because it's not approved for those age groups, to my knowledge. I don't know about the Moderna vaccine, but I think the Pfizer vaccine is in that particular camp. So, there's sort of that gut reaction for me that's, let's not do this. But then, having a student in Mashpee school, I have a lot of confidence in your team and in your planning that you've done all of your due diligence and that you wouldn't put our students or our community in an unnecessary position of potential harm. So for me, I think, sports programs are important for students, generally speaking. And I know there are, a lot of seniors who are hoping to get scouted for college programs at this point in the year. And, they're juniors who lost that opportunity last year, potentially. So, there's a lot that sort of weighs into how I sort of feel about it. So Ernie or Ronnie, if you would like to sort of relate your feelings on this as well.
Ronnie, you want to go first?
I'm torn. I'm so totally torn on this. So go ahead, Ernie. Why don't you?
Well, myself being, very, very sports-minded person. I'm an avid sportsman, and I'd love to see the kids play because they're just wonderful. But boy, is this a tough one. Boy, is this a tough one. I wish I could feel and base my decisions clearly, but and understand them clearly. But boy, I'll tell you, I think the world of these kids. I just worry about the timing. I don't know. I was thankful the nurse had to say what she had to say, and also the coach, and they make a lot of sense, and helping and giving me some kind of a better feeling towards this.
If I may add a couple other things, it was shared earlier that students will play in unschool sponsored, non-school sponsored activities. And I think we have proof and data that those facilities and teams don't have the contact tracing capability, mindset, lens that we do coming from the school perspective. Probably a little biased since it's my job. But I feel like we are a safe option, and if we take this option away from our kids, they're going to go do it somewhere else, and they're still Mashpee residents, and it's still going to impact us, and there's going to be delay. And I just feel like we have a controlled environment and the opportunity to give them their psychosocial education. Not everything is COVID, even though some days it feels that way to me. I think we have to look at like the whole big picture. And I mean, I will be very honest, it is labor intensive and it is a 7-day a week, but I think we have to keep looking at the whole picture. And I think, you know, we have a really great plan, really great team, really great communication. I trust everybody that I'm working with. I believe the trust is there for our end, me. I think people know like what we need to do. And if it's not safe, you know, we have a contingency plan to stop. We're not gonna not do that. So I just feel like we need the chance. So just putting in my more 2 cents.
Thank you.
Well,
for
what
that. I
about-
really appreciate that.
Thank you.
What about the other schools? You've got to play against other towns. Are they participating?
So Matt, you can address to the way we scheduled and how there's fewer games and some of that piece.
Yeah, so normally with a varsity basketball program, normally we have 18 to 20 games. We're looking at about a 9-game schedule right now. That may change and fluctuate, but it is right around 9 games. At the middle school level, we're usually 10 to 12 games. We cut down to about 5 or 6 games. For us, there's no real tournament here. There's no state title. There's no South sectional title. There's nothing of that nature. Our biggest thing is to get kids in to participate, to move around, to have adult interactions, and for their social emotional well-being. That is why pretty much when the state is doing this, they're by percentage. The percentage of public schools that aren't playing athletics this year are probably 0.2%, 0.5% maybe. When you look at the amount of public schools in the state of Massachusetts. So I think most of those schools have looked that way. The guidance and the guidelines for these athletic programs came from a task force that was led by the lieutenant governor, the epidemiologists, were 3 from Mass General, including one of the epidemiologists who will be the next head of the CDC. So I think, you know, there's, the MIA guidelines are certainly stricter than the EEA guidelines that cover youth and adult recreational sport. And then, you know, even on our end, I think our guidelines are even tighter than that, without having any fans, whether it's putting temperature checks on kids, whatever it may be. We're trying to do the best we can, obviously, for our student athletes, and paring that game schedule down will help. Our opponents, most of them are playing. In fact, all of them are playing with the exception of Hull, who may or may not play. So that's where we stand right now. And, you know, our coaches are obviously dedicated to making sure this happens in the safest environment possible.
I also feel that the families of our athletes really want this, and I would hope that that would maybe guide them to make better choices than they might otherwise realize, or safer choices as a family. We did talk about that there would be practices during the Christmas break, which we actually think might prevent some families from traveling who otherwise might, because their children would be engaged, you know, with their activities through the program.
And just for reference, we had no known cases from the fall athletics. We had no team participating. We had no positives. We had no spread. So indoor is a little bit different. Just on that point, I think these sports that were viewed as extremely risky sports, all being played at this point. That would be competitive cheer and wrestling. They're normally winter sports, which the MIA moved out to do a fall 2 period, which begins on February 22nd.
And
Okay.
and also the DPW, well, Rise Engineering did an evaluation of all of our school buildings in terms of the air systems and the heating systems. And then they came back for a follow-up to make sure everything that was supposed to get done did get done. And we added some other inspections to that. But the gymnasium at the high school is very, its system is very good. It has a very strong flow of air. As well. And there will be, it's prescribed where students have to take a mask break and the doors will be open. So we did meet with Catherine, like I said the other day, about making sure we were all on the same page for the support we needed from DPW. But just so you know that system in that gymnasium is working very well, the air system.
Okay. Yeah, it's tough from strictly the Board of Health perspective. It's tough. We've asked so many people to make so many sacrifices to get us to the point where we're at, which is still not so great. People whose entire livelihoods have been torn apart by this pandemic. And there's the part of me who says, if we miss a year of school sports in order to sort of make sure that some of the sacrifices aren't in vain. But like I said, the other part of me is, the team that you have, I can't understate the confidence that I have in your team to make sure that, all of the guidance is followed and that contact tracing will happen immediately and rapidly. So I definitely, I lean toward allowing it, cautiously, extremely cautiously, as I'm sure everyone is who would lean in that direction. So. Ronnie, you sort of deferred some comments. Would you like to add anything at this point?
No. No, not at the moment. I'm terribly torn about the whole thing, and I think this is the worst time. Just the worst time.
What was
With
the school
Christmas
board's decision?
It
What was
does,
that again, Ernie?
he said,
I was asking, what was the school board's decision? Did they talk to you guys about this? How does that work? Maybe I shouldn't ask the question.
well, we have had a full discussion with the school committee, and Matt Treveri did a great job presenting last night. It's not a school committee decision. It's an operational decision. So although if they were against it, they would have expressed that opinion last night. But they did not take a vote on it.
Okay.
Well, on the Board of Health perspective, we saw the results of Thanksgiving. And that's what's tearing me apart is we saw the results of Thanksgiving, and I can't imagine Christmas is going to be much better. So to approve this, I
just have to say from my perspective about this and how this whole school year has gone, we make decisions on a daily basis, and we try to keep aware of everything, but I can't live in a what if situation. I have to go day by day and do the best we can each day. And when the reality, we encounter something that puts a snag in the plan, we will address it. But I feel strongly about not giving it a try because of a what if is not really the best way given this particular year. We are poised to respond immediately if there is a nick in the plan or a challenge to it going on.
Okay. What, so I see that the first hockey games won't be played until January 8th. What about some of the other sports? Are they similarly postponed? What's the sort of start time frame for the other sports that we're looking at?
So hockey's actually going to start a little bit later than that. They've just moved to the second week of January. The basketball will be that first Friday in January. And then the time frame, they will continue through February up to about February 18th, some of that actually maybe even a little shorter, league tournament. February 9th or 10th, we could be done as quickly as the 15th, 12th, somewhere in that neighborhood. So all in all, we're looking at about a season that's only lasts about 6 weeks, 6 to 7 weeks.
Right. I guess some of the sticking point for me is just the proximity to the Christmas and New Year holidays. I mean, we're not outside of the sort of quarantine window for New Year's on the first Friday in January. A little bit more so for the hockey season.
Well, I mean, I think of the gatherings in terms of family gatherings, that Christmas is the bigger one, and we would be outside the window for that one.
Yeah. Well, people also tend to do really silly things around New Year's. Unfortunately, you get a lot of private gatherings of people from mixed households for those types of things. I mean, we saw those around the Cape all summer long. Particularly Chatham, we saw it, numerous cases that were in the news.
I think we had these concerns about gatherings. We had these same concerns, I think, over with Halloween, and none of that affected us athletically, and very little in the schools. So we had the same concerns, both the same concerns, but the results and the data from Halloween tells us that the effect on our kids, and that's particularly our athletic programs, was nil.
Okay. So I guess then we kind of have two options aside from possibly approving or denying. We could either take up a vote on this tonight, or we wait till our next meeting. We're not scheduled for another meeting in December, but we could look at maybe the 31st to see how the numbers look, and if the board is more comfortable at that point, perhaps rendering a decision. I'm not one to kick the can down the road, but I would like to see the numbers moving back in a better direction than where we're headed now, which is just up. I mean, we get the emails from Glenn and Kate every day about the number of cases in town, and there have been a few days lately where I just shake my head.
Brian,
so,
I actually thought of the same thing. And, I wish we could have this instant, and they do have an instant test, but to be able to, whether that's who that's available to, for the kids. But I was thinking the same thing, that if we met the 31st, but that's New Year's Eve, and we can move it up a day. But
yeah.
I don't want to be responsible for any parents or grandparents' death. And I'm just not looking positive on this right now. I can't from my heart. I have a grandchild in the school system, and I understand he's got a love for sports too. And I just don't want to be responsible by making that decision.
Yeah. Yeah.
And so right now I'm not looking favorable, and maybe if something changed by then, and I'm only one board member, so.
January 7th is the first meeting of the board, Brian.
Yeah.
Well, we could schedule another meeting, Brian.
Yeah, I'd certainly be willing to schedule something a little closer to the start of the season to review the current data. And I think particularly with the winter sports season, we should probably have this almost as a standing agenda item, just to kind of, touch base with you guys to see how things are going, so that we're all on the same page. We're all trying to protect the towns here. So, So what do you think about that option, Ernie?
I'm good. I get, hearing what you and Ronnie have said, and I'm good with it.
Can I
Okay.
just add?
I mean, this,
Oh,
yeah.
I'm sorry, Brian. I was just going to say, we started on this past Monday with tryouts. So our kids are actively involved with, are you saying that that has to stop until you make your decision? And I do respect what
no.
I respect what Ronnie said as well, but I also have preached all throughout the school year, instead of, saying, I don't want a grandparent's death on me, that's thinking like, what's the worst thing that can happen? And why can't people start thinking about what's the best thing that can happen? And if in families where these kids are playing, if it's important to take care of that grandparent, there are ways to do that as well and still be able to have a child participate in the sport. It's not that, and I just think that the families involved, no one wants a grandparent to pass away from COVID, and that doesn't always happen. And I just don't like sort of that doomsday approach with every decision that gets made.
No, but it enhances it. Patty, it's the holiday. It's Christmas. What, if any other time, but this is when family gets together. We
have a lot of blended families are a very common occurrence nowadays where grandparents are raising kids, grandparents live with it. I mean, you look at the numbers of millennials who are the primary child raisers right now and how many of them live with their parents at this point in time. So, they're not entirely isolated from the older population, which is much more susceptible. Those are the concerns. I mean, it's a tough decision. It's a tough decision. And for me, I would like to see where we're at in a couple of weeks I don't think you guys need to stop the practices. I think the kids are interacting regardless. My bigger concern, I think, is with the games themselves, where they're interacting with students that are outside of your capability to control, because all you can do is trust that those schools are doing as good a job as you guys are. So, to me, the games are the bigger concern than the practices and those types of things. So I think, if we can hold off on a sort of final decision on this, and if, in 2 weeks, things look great as far as numbers go and things are coming back down and everybody here is comfortable with moving forward with the, letting the season go forward, then I think we do that at that point. And if things look terrible, at least we have that one last opportunity to look at it before, as a board from that epidemiological standpoint, before the season moves forward.
I agree.
I also agree.
Well,
So
I don't think you're going to see better numbers based on what you're all saying about what's going to happen at Christmas. So it's not looking too good.
It's not, but I would just,
Another piece I didn't
This is
add.
what-
Sorry.
This is why none of the other Board of Healths have been involved in these decisions, because you involve the Board of Health and then you have this discussion.
I know. Why did the Board of Health not vote? Why did they not vote? Hello?
If I could also add, though, as far as
why did the school committee not vote?
Because it's not something under their purview unless they disagreed with the decisions we were making. It's operational. It's not policy, budget, or any of their overview.
Well,
And
the governor left it up to the local boards of health.
the other school districts, from the school nurse perspective, like we are all working together. Like, Monomoy's school nurse, like we know what kids can and can't play, aren't clear, we communicate. Like there are so many layers to this. I understand there's community spread and town numbers increasing, but it's not coming from the schools and or these kind of controlled activities. So I'm really not sure by not doing this. I think we're just going to encourage people to do other risky behaviors that don't have a contact tracer, looking at all of this and all the people that are working hard and all the buildings that are being used and safe and cleaned. I mean, the amount of effort that's gone in, if you read all those documents that Matt shared last night, and there's been a huge amount of effort. Like if there's a safe activity, school, I believe, is the safest place you can probably be. And I would even say these sports are probably your second safest activity to be doing versus other things in the community that we're going to be pushing kids to do if we cancel sports. But that's, again, the seat I'm sitting in, but that lens.
Yep. Yep. I think one of the sort of key differences between fall sports and winter sports is that winter sports are conducted entirely indoors. Whereas, the fall sports are in an outdoor environment where you have better air circulation and so forth. So there's a higher risk of transmission from these sports by their very sort of the nature of being indoors. We didn't even allow graduation to be conducted under a tent. So.
Yeah, we did, but it couldn't have any sides.
Yeah, the students, but not the parents, and we went through a whole lot of machinations to make that happen. So, I mean, I'm willing to be flexible. I just want to make sure that all board members are comfortable with any decision that we're making, and I don't get the sense that we would all be comfortable at this juncture. And I don't know if the numbers are going to look better or worse in 2 weeks, but if they look terrible in 2 weeks and we made the decision to allow it tonight, and then we all look back on it and say, oh boy, maybe we shouldn't have done that. We don't always get those back. So we talk a lot about setting precedent in Board of Health. So there's also that to sort of consider. So do we, Ronnie and Ernie, you guys want to take a vote, or would you like to put this off for a week, 2 weeks, a week and a half? Call it back on the 4th. What are you guys thinking?
If we had better statistics, which we should by then, I'm willing to meet again prior to the next scheduled meeting and find out, what's going on before, to make that decision then.
Should the school physician attend this meeting? I mean, I respect all three of you, but you're a board of 3 people. Who else helps support this decision making? Like, I don't know.
Town staff provide us with the information that we needed in terms of technical information, but the board is imbued with the authority via the state legislature and state laws to make decisions like this. So there is not necessarily input from other town authorities, including the selectmen, on these types of decisions. So I don't want you to walk away with a no tonight, but I think I kind of get the sense that we're, at least a couple of us, are kind of leaning that way, and I'd rather give you a unanimous yes if we're more comfortable in a couple of weeks. But like I said, I don't think any of us want to walk away with regrets. So I think if we put this off for a couple of weeks, see where we're at, we can do a little bit more research. And like I said, I have a lot of trust in you guys. I know you've put together a good program, but it's just, boy, is it such a tough time. It's going to be.
And the information we receive, Brian, and Pat, is on a daily basis from the CDC all the way down to every piece of information that's out there we receive. And Glenn and Kate are and list that and all what they've covered and who they've spoken with, and for the last 2 weeks. So we're on top of exactly what's happening, what's available, and all that. So we're well versed.
I've been on boards and commissions. 76 years old for about probably 40, 45 years now, and I have not seen, although every single one of them, the staff is excellent, but I have never had to read and understand, clearly being able to understand what Glenn and Kat have sent out to us on a daily basis for us to understand. I mean, I've never read this much in my whole life. and I'm sure the pandemic has caused it. But I can tell you, Glenn and Kat, you've done a wonderful job. And it's what I've read, and I feel the same way, I think, as Ronnie and Ron. I need a couple of weeks, I think so.
Can I just add something?
Yeah.
Do you have the numbers and the rates for the population, for our population, our school population, which would be under 18 years old, would be from say 13 to 18 years old, and see that rate and where that rate is going?
I mean, we have information. Kate, you probably watch this more than any of us, the state dashboard and so forth. As far as, I know the state breaks the numbers down by age group, but I don't know if they break the town numbers down by age group.
I mean, we could do kind of our own investigation into that if we, were to communicate with the VNA on those numbers, but we don't already have that data.
Okay.
Statewide, 0 to 19 years is actually going down. From
Starting to come back down.
In the previous 2 weeks, it's going down.
Yeah, and I believe that was the trend I saw in the last dashboard as well. But we did see a pretty large spike with the beginning of the school year in that particular age group, which we didn't see toward the beginning of the pandemic. So there has been, increased transmission among the younger groups, whereas we didn't see that so much before. And that's obviously the direct result of school, which we need to have. So it's, it's kind of like.
But it's not in school. It's all been exterior, outside exposures.
Well, we look at our
Right.
middle high school numbers. We have 8 Mashpee middle high positive cases since we started school September 16th through this week. And all of those, as you all know, are family, in-home transmission. So not these kids did fall sports. These kids are doing their athletics. They're doing their gymnastics. They're doing their dance. They're not sharing it amongst themselves. Like our protocols and our physical distancing and the masking and the cleaning and the hand hygiene, the bus, the seating chart, like it's all working. And if and when, even our close contact numbers, if you look at other districts versus what we're doing in Mashpee, yes, we've identified 68 close contacts. Those are really mainly all from our elementary schools as a general rule, and that's because we have recess and lunch, and I can't physical distance them in those activities for 15 minutes or more. So, we're not showing that kids doing things together with the protocols is a cause. Do I agree? And am I very worried about what our numbers are going to look like in the town after holidays? Mrs. DeVore sending out the travel reminder tomorrow night about gathering. Our governor sent it out all day today about stuff. That's where we're going to see these positives. That's where we're going to see the increase. That's inevitable. I really, truly don't believe it's going to be from these kind of sports and events. I've been doing this now for, contact tracing consistently for 2 solid months. You definitely can see a trend in the pattern, and we have I believe, again, all the things in place that I still agree that it's a safe activity. Not saying we won't have a positive, but we have a plan in place should we on how to deal with it. And our numbers don't show that these activities are what are causing it in this kind of controlled environment.
Okay. Did we lose Ronnie? Are you still here, Ronnie? I didn't.
Yes,
Oh, okay.
I got a call failed, but I called right back, so I didn't really lose anything.
Okay. Okay. All right. I saw Veronica's iPhone disappeared.
Well, I know how much they've worked and how hard they have, and I have to agree with you that we haven't seen anything, an increase. I have to agree with you, Patty. We give it a couple weeks. and I'd be more favorable to it. So right now, it's every day. I mean, we went from hundreds to thousands now, every single day. That's a lot of people. Multiply that times 7 days, it's $35,000, 35,000 people in a week that we know about.
Yeah.
And it's spreading beyond, I think, comprehension, what they initially thought. And so, and then there's so many young people that are asymptomatic.
Mm-hmm.
And, you know, so they can play healthy and look healthy, and they're carrying it. And the whole thing is just frightening right now. And I don't think the holidays are going to help. But are they going to change a whole lot if everybody stays within their clan, you know? And it might stay the same, you know?
Yeah.
But it's the increase that's so frightening. Every day I look and you think it would go down, and it's just not going down. It's just not. So
Okay.
I just can't.
Well, I think
Go ahead.
I think we kind of have a decision as a board as to what we want to do, which is I don't think we can take a vote tonight, because I don't think we're all comfortable with making that decision with the data that we have at hand. For me, coming into this discussion, like I said, I take a very conservative approach, which to me would be no sports, but I must admit I am, you know, somewhat lacking in some of the information that I need to give it a full thumbs up. And I would like to take the opportunity of the next couple of weeks to see how the situation evolves in terms of numbers, not just in terms of numbers, but in terms of what the state guidance, and if the state makes any movement on this particular issue, and, you know, render a decision on it, you know, prior to the start of the games for the season. Like I said, to me, it's the games more than the students interacting in practices. So, I mean, if my fellow board members are okay with taking this discussion up in the last couple days of this month, when we have more data and more information on which to base our decision, I would suggest that that's the course we take.
Okay, well, I'm going to motion to continue the meeting until, well, I wouldn't do it the 31st, but until December 30th. Maybe, Glenn, you can check and see if that's okay to be able to hold the meeting that particular evening.
Yeah, I'll check to see, make sure we have a room available.
Can I ask just a curious question, Brian, maybe? So we all know that there was the outbreak at the dance studio in Mashpee. Prior to that outbreak, does the Board of Health have any oversight onto that type of an organization and why they were allowed to continue before the outbreak? Does the Board of Health control any of the kind of in-town businesses that, is it because the state allowed them to continue? Like, how does that, I'm just curious as to why there was not a worry about that activity versus and because it's comparable to basketball to me, or to our.
What's that got to do with this conversation?
What?
There was a conversation with the dance company prior to their operation back when the guidance had changed. And I believe the conversation at that point was that they were going to continue on a socially distanced basis. And so there is the state guidance that has the Board of Health as oversight for any of the gathering type of businesses. So, but there was a discussion prior to them operating.
Thank you.
Yeah, and if I may add something to that too, the way that the state has put all of these business guidelines out, they're putting the onus on the business owners and the leaders to self-certify that they know what the requirements are. So essentially, like we don't have to do any pre-operational inspections or, you know, go through this. I mean, that there would just be so many businesses to have to do that with. So we do have oversight on it, but usually unless they reach out to us or unless we get a complaint about a particular location, we may not, you know, see what's going on there.
We've had more oversight with the restaurants, but restaurants are directly under our permitting authority. And so when it came down to the indoor and outdoor and the seating, we all had direct oversight of that. So we do not permit the dance studios, and nor do I think they get any permit other than occupancy permits through the building department. So they would fall under the state guidance for their specific sector type of guidance from DPH.
And as a town, you relied on the owners of that business to follow the guidelines?
Yeah, and unless we had complaints, we wouldn't go and follow up on that, so.
Did you hear about it, Glenn?
Yeah, we knew about it, sure, after the fact, yeah.
And Ernie, I guess to answer your question about why is it relevant, this is what I was referring to with, at least with our sports and our school programs. We are aware, I'm overseeing them, I'm contact tracing them, we're available if we need. So again, our students still have the ability to participate elsewhere, and I can't, you know, control those environments because they do fall out under those state guidelines. But with MIA and what is it, EEA and DESE, Matt's teaching me, you know, there's strict guidelines, there's things that we're following, and there's much more control and regulation and oversight. So that's where I am trying to focus on that. And we are seeing impact from those other programs like dance studios, other gymnastic, non-school sponsored, that are impacting. I mean, I have many children in quarantine because of these situations. And I inadvertently get to own them for contact tracing because there are kids. And the DNA is, you know, strapped. So I'm going to be doing this one way or the other. So I would much rather know that I'm doing it with my coaches who are like, know what my expectations are, know what we're doing. And they know the kids, they know the families, we have the information. I mean, it took me a while to figure out like what kids from the dance studio were ours and not. It's just very labor intensive, and all those things are still going to continue even if we don't go forward with sports. So again, I'm sorry if I keep saying the same thing over and over, but just trying to make sure you have all the information about why we're here tonight.
Okay, well, we do have a motion on the floor.
I'll second that motion.
Okay, all those in favor?
Aye.
Aye. Okay, so we will look to take this up at our meeting on the 30th and make a final decision on it at that point.
Glenn, can you confirm tomorrow the meeting date so that I can share that with other people?
Yep, yeah, because I'm not sure if it'll be on the 30th, depending upon if we can get a room or not.
Sure.
Okay. Thank you so much, guys, for the discussion tonight. And I really appreciate the work that you do and keeping our children safe. You know, it's certainly a very trying time, and you know, working together, I hope that we can have a winter sports program, and I hope that we're able to make a decision that we're all confident in and comfortable with when we meet next time.
Thanks.
Thank you so much, guys.
Thank you.
Have a good night.
You too.
Okay. Let's move on to, let's go back to item number 3, discussion of the proposed return to school travel order regulation.
Okay, this actually did originate with Stacy Skakel, the school nurse coordinator, and we had discussed a week or so ago where there was a couple of situations where people who had returned from traveling and had a negative test prior to their return to the state and then ended up getting sick when they got back to the state. So Stacy was wondering at that point, is there a way to change the actual testing protocol for the travel order? But it ended up that the two instances, that was it. It was left at 2, and there was not a trend. And so Stacy at that point asked us not to basically go forward with the regulation because it was just two instances. So I don't think there's any necessary action that we need to take at this point.
Okay. All right, so since we don't need a vote on that, is everybody okay with a no vote on this particular issue?
I'm okay.
All right. Let's see, review and approval of request to act as burial agent from Deb Dammy, the town clerk.
Okay, so there was a written request from Deb Dammy, the town clerk. You should have been forwarded the cover letter, and the town clerk has been doing a lion's share of the review of the death certificates ever since we went to the electronic death registry back basically at the end of 2014 into 2015. So where her department is doing the work, she's requested to have the burial agent moved into her position and not as the health agent. And I'm okay with that. Per the state, about 50% of the towns went to using the town clerks as the burial agent because they're really the last people who see the death certificate because they have to issue the certified copies of the death certificate. And the burial agent, either as the town clerk, but right now the town clerk and the health department, the agents have the right to go into the death registry and sign off and release the death certificate after we review it. So we would still have that authority. It's just that the agent position would be moved to the town clerk.
Sure, if you're okay with it, Glenn.
Yeah, I'm fine with it. I kept the position back when the change was made because I read that the statutes mainly should have it under the Board of Health, but it really does state that the town clerk or the director of cemeteries or any appointed person who is set by the Board of Health to oversee the death certificates can do it. So where the town clerk's office has been handling more than the majority of this, then I'm all right with it.
Okay.
I'd like to say that since I'm chairman of the cemetery commission and have been from when we built our new cemetery to today, and sir, I feel this is a good move. Very good move.
Okay. Yeah, if you're, obviously 50 towns have been comfortable doing it, and if you're comfortable doing it, and if we're allowed to do it,
Okay, well, a motion to approve and the town clerk's, Debbie Damey as town clerk, her request as burial agent for the town of Mashpee.
I'll second that.
Okay, all those in favor?
Aye.
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 Thank you.
Okey dokey. One thing off your plate, Jess.
Right.
All right, let's see what else we got tonight. Review and discussion of the landfill gas monitoring reports.
Right. This is just an update from the August 2020 sampling event. And
Glenn, I thought you were going to get that gas monitoring well fixed, or you're going to look into getting it
yeah,
fixed.
no, I know. I'm going to. I'm still not sure it's gone because I know that well was. No, I may be getting it confused with one of the water monitoring wells.
Aren't there two?
No, this is a gas well. I was thinking of the well that had the baler stuck in it, which I think they finally rectified, because that was in the same area. But this is a gas well. This is a small diameter gas well.
Oh, okay.
But yes, I am going to get that looked into to being replaced.
Okay, well, can you keep us up to date on that? Because
Yep.
I'd like to see that get done. It's been a long time.
Okay,
That's my only comment.
yeah, no, it looks good. I don't recall with this particular one. Do we need to vote to accept the report, or are we good on this one?
No, I think we're good on it.
Yeah, I don't have any comments. Ernie, if you don't have any comments, why don't we move on? Okay. So let's move then to the review of compliance for 73 Levels Lane.
I don't have anything new on this. I have not had a chance to follow up with the people at the property. Had several plans to get out there, and each time I've been sidetracked. So I'll follow up for the next meeting.
Okay.
I just want to
Yeah, well,
comment that I have caught up on it and read on it and gone by it. So when the discussion does come at some point, I guess ready for the discussion.
Okay. Yeah, I think I missed this one. Yeah, I missed the 5th of November.
I'm sorry, what were we talking about?
73 Levels?
Oh, I have some comments on that.
Okay.
Well, Glenn states that they went out there and I don't know, the granddaughter or whatever. They've made some progress on it. However, those same cars that have been there for the last 20 plus years are still there. And I want something done about that. I want those vehicles.
Yeah.
Huh?
I made a comment to them about the vehicles when we were there.
Yeah.
I just told them that they need to get rid of them. So I did make them aware of that. So.
Well, I think we need to send them something that tells them to give them. That people pay money for those, Glenn.
Right.
That just amazes me that they sit there. It's valuable metal and stuff. So I'd like to send a letter to them telling them that the vehicles shall be gone within so much time, you know, or that it's going to be added to the existing fines, you know.
Yeah.
You know, I'd like to do something like that. And then you were going to look into whether or not the trailer was tied into the septic.
Right. I've not even gotten a chance to get back out there, Ronnie, to double check.
Okay. Well, I'd like to have the fire department to go to the trailer and make sure everything's okay in there, the heating system, because I've actually witnessed the trailer that was leaking carbon monoxide years ago, and the mother and the child would rush to the hospital. So I want to make sure that everything's okay with that trailer. So maybe you could call and set up an appointment. You have the fire department go out there to check that.
Okay, we can do that.
And did you inspect the dwelling? Were you going to inspect the dwelling?
I've not gotten back out there. I really don't think anything has happened with that dwelling. I think it is totally sat empty for these last 20 years.
Okay, but maybe it needs to be condemned.
Right, when I get back on the property, I will do that.
Yeah. Thanks.
I mean, that's serious stuff because of, I don't know. We don't even know if it's heated by oil or gas or what, and if everything's shut off, and if it's not, what's going on? Is it overrun by rodents? Is it, yeah. So anyways.
Yeah, I missed this meeting, so I'm kind of catching myself up at it as we're talking here. So that there's a camper trailer on the site, and somebody's living in it with a kid. Is that still the case? Is it like a rental? Like what?
No, back in the day, I can't even remember where it was, Brian. It was so long ago, but I was just giving an example.
Oh, I know, but I'm looking at the comments for this particular case from the 5th of November meeting.
I think there was a child living there with the mom.
The new issue is the habitation of the trailer with the child.
Yes.
I mean, I always thought you couldn't live in a trailer on a piece of property like that. I thought that was.
I'm looking to either move them onto the tribal property or get tribal housing for them. So
okay.
I just need time to look into that. You're right. They are not allowed to use the camper at the without the Board of Health position, and that's why that we need to check to make sure to see that they have potable water and tied into the septic. In the meantime, they're allowed to use the camper less than 30 days, but more than 30 days they need Board of Health permission. So I'm just still working at putting that information together.
Okay. All right.
When I first came on the board, I really had no knowledge of this at all. And my comment was that I didn't really want to, become a part of the discussion at that time. And then you sent me along everything that I needed to read and understand. And so, Arnie, I can agree with you on the number of things you've said. It's time. We need to do something.
Yeah.
Well, I'd like to motion to send a letter to the owner about the vehicles, because God knows what's gone into the groundwater over there, over the years.
Yeah.
And they are by the river. Yeah.
Do you have anything specific that you would like to include in that letter?
Well, maybe in it, Glenn could also say that he'd like to gain entrance into the dwelling for purposes of inspection, too.
Mm-hmm.
Yeah, we've done that before.
Okay. And I was just looking at your additional comments here up toward the top, Glenn, that if comments from town council that states if the Board of Health deems the property a nuisance, it should be used the same process as the other two properties, which was the sanitary code used to issue to cite the owners of the property. So,
Well, that was back when we were going to take them to court, because we were all set to have council issue a complaint in court because they've been sent letters and have had fines accrue. So that the board, rather than having to wait the 30 days, the board was going to send it right to council. But then the day before the meeting, or the day of the meeting, last November 5th, Kate and I went out there and found that there was somebody on the property and had cleaned up a portion of the property. So at that point, we delayed the issuance of the complaint in court, and just needed to go back and reestablish communication with the people on the property and determine the condition of the trailer and of the dwelling. But I can send another letter to the owner, which is Ron Turner, which is the father of the occupant right now, and get a time and a date to go inspect the trailer and the dwelling.
And the Taylor could have been there, Glenn.
I'm sorry?
Back in the day. When I was so long ago, like I said, it was good 20 plus years ago that I inspected the trailer, and there was.
Yeah, this is a different trailer.
Yeah, do you remember that?
Yes, I do.
Oh, okay, good.
Yeah, that trailer is still there. It is off to the left of the house, but the trailer that is being occupied right now is out front of the house.
It's not the same one?
No.
Okay, what is there though, huh?
It looks like a relatively new trailer. It's look like good condition. So, but I do remember the one that you're talking about.
Well, maybe you can ask the fire department to go there.
I will do that too.
Just for safety, safety of the occupant.
Absolutely.
yeah, particularly with a child in this cold weather, that's just a little scary to me.
Well, I am going to try to get them onto tribal property. I'm hoping that is an option.
Okay, good. Okay, I believe we have a motion on the floor. Is there an understanding what the content of the letter is?
Well, to inspect the dwelling, to set a time and a date to inspect the dwelling and the trailer, and if the dwelling is unfit for human habitation, we'll make that declaration, and if it's vacant, we'll do an emergency condemnation. So
Okay.
and
Let's get a time frame on the cars. What would everybody suggest?
well, they're already being fined for the cars and for all the rest of the debris on the property.
Well, let's add the cars in. Just they've got to get rid of those cars. And the is the ambulance still there?
Yeah.
Let's. As I said, it's easy enough to get rid of them, and they can get money for them. So there's no purpose in keeping them there.
Yeah, I actually have a name of somebody, a salvage company, who will pay them for them, because I just got rid of a vehicle.
Good. Well, maybe you can, give her a few names. But we need to put that in the letter and give a time frame that the vehicle shall be removed within so much time.
All right. Well, we'll do it for the next meeting then, or the January 7th meeting. Do you still want to have the January 7th if we meet on the 30th?
Yes, because on the 30th, I don't know about everybody else, but I would like to just cover the school at that point.
I agree.
Yeah, let's kind of just stick to the school at that meeting, and then pick up our regular business at the 7th. Okay, so we have a motion. Do we have a second?
Second.
All those in favor?
Aye.
Aye.
Aye. Okay. Let's see. I think we have one item left, which is the COVID-19 update. It was nice to not talk about COVID-19 for a few minutes there, but let's go back around to COVID-19 again. Did everybody get a chance to read the update?
Yes.
Yes.
Okay.
Any questions on it, so we don't have to read it?
Yeah, I noticed it's a lot of it's the same.
But
So.
you'll see why I got nothing else done, and poor Kate has been cranking on all of this. So
Yeah.
You guys have been great at getting this information out.
The building permits and septic permits have not slowed down. If anything, they've picked up. And Kate has been primarily doing the COVID and still out doing perks and inspections. And it's been rather busy. So I apologize for not getting to board stuff, but you can see what we've both been involved in.
Yeah. One question I do have on the reverse 911 call, do we get any sort of statistics on what the success rate is on those calls? Or is it just kind of, they just go out and?
Well, I believe we only had a couple callbacks from people with questions, but otherwise I don't know how to value a success rate to that.
Okay.
Well, I've been involved in a lot of those calls over the years, and believe me, there's a success rate. Yeah, through the county, through the state, and you know, you'd be surprised. People do listen. They do pick up the phone and listen. And if you don't get call-ins, it's because it's been explained properly. Been explained good enough to them.
Because why?
Personal opinion. Because the call itself is really a good explanation, and there's not a need to call and ask, what questions about it.
Right.
I didn't get any calls, did you? Did you folks did? Brian and
I did get,
Ernie?
Yep.
Yeah.
I did get this one.
Yeah, okay. Oh, wait a minute.
Yep.
Here's a question. I did hear, and I don't know if it's true or not, that if you don't have a land phone, you don't get a call.
I
I have
believe,
no way of.
yeah, on the cell phones, I believe you have to be signed up on the town's distribution system to get it. So if you don't have a landline, then you would have to have your cell phone signed up. So there may be a reason why some cell phones don't get called.
I have a
Okay,
landline.
then there is truth behind that. Because I have a land phone. Yeah.
I did too.
Do you have a land phone, Ronnie? Ronnie, do you
what?
have a land?
I
Do
do.
you have a? Oh, really? Okay.
Yes, I didn't receive one. Not that I really needed to, but I was just curious. How many went out? Just one, or?
Yeah, it's just the one message. Yeah. But
If you don't answer it, it repeats. If it's not answered, it repeats. It'll repeat a certain amount of times, I believe, if it's not answered.
Yeah, I got one of the original numbers, so.
Yeah, mine left a voicemail on my cell phone. Would it perhaps be worthwhile to do another one which is focused on sort of the holiday concerns that we have with people not participating in gatherings and so forth, to sort of echo some of the state output? maybe we can get some more of that type of messaging out with that system.
Well, that was kind of the hope that we had with the press release, because that was the message on the press release was about the gathering and the holidays. So we could certainly boil that down a little bit, and because we're limited on the number of characters in the reverse 911 call.
Oh, okay. Yeah, I just think as many outlets as you can get that messaging on, the better. I mean, I don't know if it'll change hearts and minds, but people who didn't really think about it before might take pause, I would hope.
Well, I watched a webinar today that was done by MHOA and DPH, and the town of Rockland does a weekly reverse 911 call, all of their updates.
Yeah. Wow.
So, and the town manager actually is the one who does that on the 911, first 911 calls.
Yeah.
So I think it's a good thing, and as long as we have support from upstairs, then we'll run it by him again.
Yeah. No, that sounds good. Yeah, I mean, the town manager has been very supportive, so that would be good if we can get more of those messages out over the coming days. So.
Okay.
Yeah. I wanted to be on that same webinar. I ended up on another phone call, so I couldn't catch that one, unfortunately. I had signed up for it, like so many webinars. Okay. Does anybody else have any other questions, comments, concerns, gripes? We don't have any gripes about you guys, though. So.
I just have one thing. If I hang up my phone right now and try and get on the, well, maybe we're still in meeting. Maybe I should wait till after we're not in meeting. But I just want to try and just work it out so that I don't have to use the phone. I was just wondering if I mean, over here it says join auto. Now, I get phone numbers. I get a big board with a code. So that means I can't join auto. Is it?
I've had the same issue, and I think I mean, when we first started doing these, I think David had recommended that we don't use the computer audio and call in.
That was back when we were in the big room because of the we were using the phone and there was an echo.
Oh, okay.
And feedback. There was a real nasty amount of feedback from people's computers on the phone. So I think that was when we were in the big room.
Oh, okay. I mean, I've been using my phone for the audio portion myself, so.
You know, I think I just figured it out, but next time.
Ernie, if you want to set up a Zoom meeting with us during the week, we can do that. And so you can try it.
You guys are buried, you know, if you have the time, you know, I'm fine. I can make the time anytime, but
okay.
You guys are buried.
Okay.
If you're buried, if we can do it, I'd be glad to.
Okay.
You know, give me the time. It's good for you guys.
Okay.
Okay, great.
Well, they're not buried anymore because we gave up the burial permits.
There it is.
Hey,
Board of Health pun there.
hey, Brian. I have one more agenda item that I need to add. But we won't have to take any action on it except to continue it, but I need to add it so we can address it at the next meeting.
Okay.
And that was we had a septic installer install a septic tank without a permit, and the letter went out, and it just didn't make it onto the agenda. So if we can add it to the agenda and continue it, we'll have it for the next meeting. and that was for Michael Esker of Dirt Works from Eastham, and the address is 83 Troon Way.
Okay. I will look for a motion for that.
Motion to add 83 Troon Way to the next regularly scheduled Board of Health meeting.
No, to this meeting, and then we'll have you vote to continue it to the next meeting.
Why?
I
You
need
didn't have
to
it on
add,
there in the first place.
because the letter that went out was for this meeting.
Oh, okay.
I'll second it.
Wait, we get a motion to add 83 Troon Way to this agenda.
Yes.
Okay, so I'll motion that.
I'll
Okay.
second.
Yeah.
All those in favor?
Aye.
Aye.
Aye. Okay. And a motion to
And
continue?
no motion to continue 83 Troon Way to the next regularly scheduled board meeting. Right?
Well,
Yep.
let's go with January 7th, because we're meeting on the 30th and only doing the school.
Right. That's okay. To January 7th.
Okay. We have a motion?
Yes.
Okay. Do we have a second?
Second.
All those in favor?
Aye.
Aye. Okay.
Thank you. I have no further business. Unless
Very
Kate
good.
does. Kate, do you have anything?
Well,
All
Oh,
right.
sorry, I was
Very
muted. No, I'm good.
good.
Have a good night, guys.
All right. I'll entertain a motion to adjourn.
I'll motion to adjourn the meeting at 8:50.
Do we have a second?
second.
All those in favor?
Aye.
Aye.
Aye. Very good. Thank you guys so much.
All right.
For hanging
Thank
in there
you.
through
We'll
the
be in
discussion.
touch.
Have a nice
Bye-bye.
holiday.
Yeah, you
Sounds
too.
good.
Merry
Yeah.
Christmas.
Merry
Guys.
Christmas.
Merry Christmas, guys.
Merry Christmas.
Bye.
Bye.
Good night.
Bye-bye.